Hi, my name is Bev and I'm a member of Socialist Alternative from Brighton. I wanted to speak about my experience with regards to the COVID crisis in respect of my role as part of the nursing team in a busy GP practice. Prior to the government's decision to announce a lockdown, we were still seeing patients face to face without using full PPE. The advice from the local CCG, that's the Care Commissioning Group, was that it was not necessary, not even for staff in the at-risk group with underlying health conditions. Once the lockdown was announced, a new set of guidelines were also brought about. Full PPE to be worn when seeing patients face to face and only to see patients where absolutely necessary. The GPs made a decision, as advised, to switch to telephone appointments unless they deemed it necessary to examine a patient. The nursing team continued to see patients daily, often in close contact and always less than 2 metres apart. So it is clear that due to not knowing if someone is infected with COVID, protection and safe practice is of the utmost importance. We have a daily PPE count to ensure we have enough stock available. A couple of weeks ago, we put orders in for stock with several suppliers because we were running low. All of the suppliers said that stock was not available. By Thursday last week, we were down to our last 50 masks, enough for just about one more day at a push. The managers here at the practice told the CCG that if we did not get masks, we would no longer see patients face to face. Interestingly, we received stocks from suppliers at the beginning of this week and now have a really good supply. We should not have to make such demands in order to get basic means to protect ourselves and our patients from infection. We originally ordered visors, which never materialised. Thankfully, a patient made 10 of them for us. But should we be having to rely on the goodwill of others to meet guidelines to avoid the spread of COVID-19? The impression is that without clear guidance or leadership from this government in the first instance, the local commissioning groups have had their response to the crisis delayed, and that has therefore had a knock-on effect on the local hospitals and surgeries as they need this guidance to make changes in their respective settings. The expectations of healthcare workers is always that we are willing to go above and beyond without question, missing lunch breaks, even ones we don't get paid for, arriving early, staying late, lying awake at night, wondering if you could have done something better for your patient. This is what we do because we actually want to make a difference to our patients. The government know this, and this is often used as a type of emotional blackmail. But they are asking too much by putting healthcare workers at risk of their lives. I know of nurses who have continued working, even though they have received a letter from their own consultants or GPs saying that they should stay home and shield because they have underlying health issues. They either cannot because they are concerned they won't be paid, or they feel so much loyalty that they want to stay mucking in with their fellow workers. So what I would really like to say to this government is we don't want your claps. We don't want to be called heroes. We want PPE in a pandemic and a fair living wage from now on.